What's going on? This is Greg with sportsrehabexpert.com. Today we're going to be covering our shoulder external rotation at 90 degrees of abduction progression here with exercises. So we're going to run through the easiest version and progress on to more challenging versions that you'll find in the Sports Rehab Expert workout programs, as well as our continuing education courses for rehab clinicians and strength coaches. All right, so the easiest version of this is just body weight. I'm going to show you the setup of it. You're going to put one foot up on the bench. Closer you bring the leg towards you, the more 90-degree angle you're going to get. Find a comfortable point for you to rest at, and rest your elbow directly on the knee. This opposite leg down is just going to be in a comfortable position, resting so that you feel balanced. Now with the elbow is going to be on the inside of your patella, so the inside of the knee, and you're going to be pushing gently backward into that knee. And don't let the knee flail out to the side. You're going to meet that resistance back with the knee so that you hold yourself in a stable platform. So I don't want your elbow flailing all over the knee. I want your knee and elbow to be locked together to allow you to just rotate the arm down towards the floor and then rotate back up towards the ceiling. So you're just going to move back and forth through this range of motion. One key concept of this is as you come down, you don't want your shoulder to feel like it's dumping forward. You want to feel like the shoulder is scooping back and underneath of the shoulder. So as you rotate down, that shoulder should stay retracted in the joint as you rotate the arm towards the floor and as you lift back up. Your torso position is sternum pretty much parallel with the direction that this leg is going. So I don't want you over rotated here. I don't want you rotating out of it. Just find that middle point, keep the sternum facing outward, and again, you're rotating towards the floor, keeping that shoulder retracted, and rotate back up. Once you have the movement down, feels comfortable, no pain is lingering, start adding some weight. Right now I just got 5 pounds, but I've progressed people upwards of to 10 pounds, 15 pounds. Again, it just depends on their current level of strength and their current mobility capabilities. So never work through pain. You'll go down into a little bit of a stretch position, but again, don't let that shoulder dump forward. You want to keep that shoulder retracted in the joint as you lower down and raise back up. Should not be pain, should feel a generalized stretch or pressure and just a generalized workout sensation to the shoulder. Never working through pain. Perform this for a number of different sets or reps, somewhere between 3 to 5 sets of 5 to 10 reps. There are times that I'll go higher too and do 12 to 15 reps of this exercise as well. Or even do it as a burnout set, just doing as many reps as I can in a row. Again, never working through pain. If someone is having pain with this exercise, we're going to pan to a different variation. That's just keeping the arm down at 90 degrees, likely you've seen this. And then also going to show you if someone has trouble getting into this position for whatever reason, just depending on their hip mobility and their capabilities from a movement capacity standpoint. I'm going to show you an easier version to get set up. This is pretty simple though, and ideal for a lot of different workout settings. Okay, so the other alternative setup that you have is sitting on the floor, or if you're at home, you could just be sitting on a couch with your arm on an armrest with pillows stacking up to keep this at a 90-degree angle. Again, I like this 90-degree angle because we can be resting our elbow on something, as opposed to when you try to work this exercise with the elbow unsupported with a band or even with a dumbbell, you're going to get a lot of different muscles activating to hold that position, mainly your deltoid, and you're not going to target the rotator cuff as much as you want to. So this supported 90-degree position is a nice way to work this position. Again, you can modify the setup if the previous setup wasn't ideal for your current patient or your current client. And again, you're going through a range of motion that is comfortable and that you can control. And again, you're thinking about keeping that shoulder retracted, especially as you gradually and slowly, under control, lower that weight down towards the floor and then raise it back up. So that shoulder stays retracted the whole entire time. Then finally, as I mentioned, if that is an uncomfortable setup or pain is limiting you, or if say there's a shoulder surgery that limits your ability to raise your arm up overhead, start at this 90-degree position. Now, this isn't as simple as the exercise looks. There's a lot of details that you want to focus in on this exercise. Now, The muscle that we're targeting is, again, your rotator cuff, so it should feel just right through here, so just on the back side of the shoulder, wrapping around to the side of the deltoid, and it should feel deep inside that joint. What you'll see is a lot of people will use their scapular muscle, or this muscle back here, and think about pinching their shoulder blade as they rotate out, and you'll see their sternum rotating with the movement too. You're just using your scapular muscles and even your neck muscles at that point in time to accomplish that movement, and many people actually get neck discomfort after doing it that way. So don't do it that way. Keep your sternum facing forward. Just rotate through your shoulder joint like a rotisserie, rotating about an axis. You're going to rotate right about that shoulder joint and only go through a range of motion that you can rotate through the shoulder. Don't go further where it forces you to rotate out of that position or turn your sternum. And you'll notice that you feel a very different sensation of where the muscle is working, and that again is where you're targeting the exercise, this back side or this posterior rotator cuff muscle as it wraps around right to the side here of the arm. It's called your infraspinatus.